Hello. Dr. Hayworth here, Bugsy. Breast lifts. Okay, so patients come in and they basically fall into the category of mommy makeover. What is that? Well, mommy makeover is basically exactly that. Makeover of a mother. Someone who is presumably postpartum, who have suffered the physical ramifications upon their body. Mommy makeover. It's not focusing in on one particular anatomic area. It's basically a generic grab bag term referring to an overhaul. So breast lifts, aka mastopexy, there are 4 types of them. In fact, I employ all 4 as necessary, as indicated in my patients. So the simplest one is a nipple lift or crescent lift, where there's an incision confined to the superior border of the areola from, let's say, 3 o'clock to 9 o'clock, if you liken the areola to the face of a clock. And by cutting out a designed crescent of skin just above that areola, when you close that resultant wound, that will actually tilt the areola and nipple complex slightly upwards. I liken it to the cherry on top of the cake. It's not really a powerful breast lift, but in those particularly well-selected patients, that's all they need. And that will actually give the illusion that the breast is more youthful and perky. Now, the second type of breast lift is the Benelli mastopexy. I still consider that a minimal incision type breast lift where the resultant scar is confined to the circumference or perimeter of the areola. The goal of that is to make the areola smaller, more symmetrical with the other side, and also by cutting out some extra breast skin and putting a purse string around the perimeter of that donut type shaped excision of skin and areola, we can tighten it down like a purse string. So your purse is open with the string, you pull it tight, the mouth of the purse closed. Advantages are, number 1, minimal scarring. Number 2, you can actually reduce the size of the areola to a certain degree and provide symmetry between the left and the right breasts. It also, of course, has the power, by excising some extra breast skin, of tightening up the whole breast envelope. However, it has limitations. So whenever you're trying to employ a mini type solution, such as a Benelli mastopexy, to a maxi problem where, for example, the bottom of the breasts are lying at the level of the umbilicus or belly button, you're going to have problems. The breasts are going to look flat and misshapen, unnatural, and ugly. So we don't want that. So there is no free lunch in life. That leads us to number 3, a vertical mastopexy. That is basically the most common type of mastopexy I perform in my practice. So it involves, again, an incision around the whole circumference of the areola. You can make the areola smaller, but there is also a vertical component running from around the 6 o'clock position of the areola down towards the middle of the breast crease. It's a powerful, good operation. And even though there is that vertical, potentially most visible component of scar on the breast, surprisingly, that scar heals very, very well, almost to the point of invisibility in the majority of patients undergoing such a surgery, regardless of skin type. That leads us to the granddaddy of them all, the classic Weiss pattern, upside down T or anchor cut scar mastopexy, where there's an incision confined to the perimeter of the areola to make that smaller, a vertical component as well, sharing that with the vertical or leisure mastopexy. And finally, there is a horizontal component running just above the inframammary fold. And that is the most powerful surgery of them all. And that is used for patients with maxi problems. So if your breasts are down here, you're going to need to employ a bigger solution, such as the upside down T anchor cut mastopexy. So I hope this helps. Believe what you see and not what you watch, but believe what you watch here. Stay educated, and thank you for watching.